busy, tiring, manpower is also stretched. As this goes on, people are also feeling the strain of the situation. Not to mention that the patients are also very, very sick, and unfortunately, not everyone makes it. And because of that, it does take a toll as well.
The COVID-19 virus continued its game of cat and mouse well into 2021. With each new variant, Singapore's hospitals had to mount new defences to keep hospitalisation rates down. At Singapore General Hospital, the spike in numbers that preceded the discovery of the Omicron variant added significant pressure on healthcare frontliners.
Well, as you can see, all of us are taking care of a lot of COVID patients, and it's busy, but of course, it's what we have to do.
As patient numbers in the ICU wards mounted, reinforcements came in the form of staff who had undergone the infection control training program.
I just give you an oxygen tank and you bring your impact inside.
I was being deployed here 2 weeks ago. Initially, when they tell me I'm going here, the part of me is I'm very scared, thinking it's COVID patient. After some time, because the staff here are very helpful, so managed to cope up slowly and learning a lot of things.
Madam Noor was one of the patients in the isolation ward. She was 36 weeks pregnant with her first child.
I was transferred from KK to here because my condition got worse. I think I start to shiver, and then my heartbeat and fever start to raise very high, and my baby heartbeat also start to raise. I think about 190. The doctor are all very friendly, very nice, very understanding. They also allow me to ask questions, make sure that I'm not really worried lah. Hopefully, I won't deliver in the isolation ward lah, so I can be with my husband. I just want to recover and go home.
To accommodate the surge, it became a priority to ensure there were enough beds for patients.
We have 41 ICU beds allocated for COVID cases. We have to make sure that our capacity for ICU bed is available at all times. Okay, if the patient can be de-isolated, we will eventually need to move the patient to another ICU to give way for a new cases.
Just make one hour for my neighbor patient.
That's why all disconnected already.
Disconnected.
All disconnected.
Yes.
Really? The doctor at your town now, we will turn over there.
This patient is a recovered COVID patient who has high value or CT value, therefore is being de-isolated from an isolation ICU and come to a business as usual medical intensive care unit, which is Ward 45. From here, we will continue to provide further care to manage this patient.
For the past 1 to 2 weeks, it has been very challenging. We have been experiencing more COVID cases coming into our ED. The bed situation has been very tight for us also for the past few days especially.
It's a combination of balancing our business as usual activities where we still have all these referrals from the polyclinics for the day-to-day issues, for concerns of heart attacks or stroke, all these common acute complaints that need to be attended to, combined with the fact that COVID patients or patients that need isolation need a certain kind of space within our department and within the hospital as well. And also because some hospitals are really full, we've also been receiving patients being diverted to us due to the stresses that other emergency departments are facing.
Patients exhibiting acute respiratory symptoms such as cough, runny nose and fever, or test positive for COVID-19 through ART or PCR were placed in the fever area.
The first thing is we will sort them based on their severity or acuity. Then from then the doctor will come in and will do a thorough assessment. And from then the doctor will be able to give proper disposition, what's the best plan for the patient. Either they can get admission or even discharge to facilities or discharge to home.
Ward at Boya is where suspected and confirmed COVID-19 patients who are more stable, independent and do not require oxygen are isolated. Compared to the other COVID-19 wards, it is rather quiet, and this is why.
At the moment, patients are more acute, so most of them are actually in the main building. We have a total of 50 beds, when the peak of the patient load is about 42. And currently we have 4 patients, 3 COVID positive and 1 stay-home notice. The stay here is usually quite short, 7 days to 10 days, depending on their swab result. Definitely there will be fear looking after COVID positive patient because we are all healthcare workers. I mean, we have our family to look after, the young and the old.
Despite the stresses brought on by COVID-19, Singapore's healthcare workers look forward to better times and share their thoughts, feelings and hopes for the future.
Certainly, I think all of us are hoping that COVID situation will stabilize further, where we all can reach a steady state of balancing business as usual activities combined with managing of all these active COVID cases that's still going to be developing.
We want to go back as per normal. We want to have parties. We want to have gatherings. We want to go out with friends and also our colleagues.
The first thing I think I'm going to do is spend more time with my family members, with my wife, my kids, my parents. Because they are my support strength, my pillar of strength. Without them, I don't know I can go through this.
I need rest. Yes, really need a good rest to relax in my mind and also my body. But at the same time, I still have to work.
Cannot go back to Malaysia because this COVID since lockdown. Although I miss my family a lot, but I think they will be proud for me as a frontliner working at here.
I hope the public know that as nurses, we are not just someone who is there to pour a cup of water or make Milo for you. We are there to assist you in your daily life, your care, emotional support, someone in which that empower you and advocate for you for your health and safety.